Do you know who is at high risk for prostatic carcinoma and how to detect it early? Welcome to a discussion on prostatic carcinoma, commonly known as prostate cancer. It's a topic that's important to understand as prostate cancer is one of the most prevalent cancers in males and tragically the third leading cause of male cancer deaths. However, it's not all doom and gloom. When detected early, there are more treatment options and the prognosis is much better. That's why we're here, to shed some light on this disease, its risk factors, and how to detect it early. You may be wondering, what exactly is prostatic carcinoma? It's a form of cancer that develops in the prostate, a small gland that produces seminal fluid in men. Now the big questions are, who is at high risk and how can we detect it early? Understanding the risk factors is the first step in early detection. Risk factors for prostatic carcinoma are diverse and multifaceted. This cancer does not distinguish between individuals, but some factors can heighten a person's risk. For instance, ethnicity is a crucial factor, as individuals of African descent have a higher incidence. Your dietary habits can also influence your risk. A high-fat diet can double your risk. Another significant factor is your family history. If a first-degree relative has been diagnosed with prostatic carcinoma, your risk doubles. If both first and second-degree relatives have been diagnosed with the disease, the risk ninefold. This underlines the importance of being aware of your family's medical history. Now let's delve into the epidemiology of prostatic carcinoma. It is the most commonly diagnosed cancer among men, making it a major health issue. It also ranks as the third leading cause of cancer deaths in men, following lung and colon cancers. The risk of prostatic carcinoma rises with age. By age 50, up to half of all men are at risk of developing the disease. In a man's lifetime, the risk of death from prostatic carcinoma is 3%. 75% of all cases are diagnosed between the ages of 60 and 85, with the average age at diagnosis being 72. However, there's a silver lining. Early detection can lead to successful treatment. With regular screenings, prostatic carcinoma can be detected before it spreads, which significantly increases the chances of successful treatment and survival. To sum up, the risk factors for prostatic carcinoma include aspects of ethnicity, diet, and family history. Its high prevalence among males and its position as the third leading cause of male cancer deaths highlight the importance of regular screenings and early detection. Understanding these risk factors and the prevalence of prostatic carcinoma is crucial for early detection and effective treatment. Prostatic carcinoma is a complex disease that affects various parts of the prostate. Its pathology is primarily characterized by adenocarcinoma, accounting for over 95% of cases. This form of the disease is often multifocal, affecting multiple areas of the prostate. Another form of prostatic carcinoma is urothelial carcinoma, which makes up about 4.5% of cases. Unlike adenocarcinoma, this form is associated with transitional cell carcinoma of the bladder and does not follow the usual tumor, node, metastasis staging. It also doesn't respond to hormone treatment. Additionally, there's endometrial carcinoma, which is rare and affects the utricle of the prostate. Anatomically, the disease can manifest in different zones of the prostate. 60 to 70% of nodules appear in the peripheral zone, while 10 to 20% arise in the transition zone. The central zone is less commonly affected, with just 5 to 10% of nodules forming there. Clinically, prostatic carcinoma is usually asymptomatic, often making early detection challenging. It's most commonly detected by a digital rectal exam, or DRE, which can reveal a hard irregular nodule or diffuse dense induration involving one or both lobes of the prostate. Elevated prostate-specific antigen, or PSA levels, can also signal the presence of the disease. Sometimes it's discovered as an incidental finding during a transurethral resection of the prostate, or TURP. When the disease is locally advanced, it may cause storage and voiding symptoms, or even erectile dysfunction. However, these symptoms are uncommon without the spread of the disease. When metastatic, the disease can spread to the axial skeleton, causing bone metastases. Visceral metastases are less common but can affect the liver, lung, and adrenal gland. Symptoms such as leg pain and edema can occur when nodal metastases obstruct lymphatic and venous drainage. Understanding the clinical features of prostatic carcinoma can aid in early detection and treatment. Investigations play a crucial role in the detection of prostatic carcinoma. In the pursuit of early diagnosis, several investigative methods come to the forefront. One of these is the digital rectal exam, or DRE, a procedure that involves the examination of the prostate gland for abnormalities such as hard irregular nodules or diffuse dense induration. Another key player is the prostate-specific antigen test, commonly known as the PSA test. This is a blood test that measures the level of PSA, a protein produced by the prostate gland. Elevated levels of PSA often indicate the presence of prostatic carcinoma. Further investigations may include truss-guided needle biopsy and CT scanning to assess metastases. MRI is also being explored for its potential role in detection, staging, and active surveillance. The disease can spread locally, through lymphatic routes to regional nodes, and through early hematogenous dissemination. Early detection is key in the management of prostatic carcinoma, and these investigations play a crucial role. Prostatic carcinoma is a serious condition, but knowledge is power. We've journeyed through its risk factors, the epidemiology, the clinical features, and the essential investigations. Understanding this information empowers us to recognize the signs early, paving the way for timely intervention. Let's continue this educational journey together. Subscribe, like, and share this to spread this vital information. Your actions can help in the early detection and treatment of prostatic carcinoma. At the end of this insightful discourse, please subscribe now to join our community. Give us a thumbs up to motivate us to bring more exciting, challenging, and high-quality videos to everyone. Our channel, MedSign Health 360, is loaded with numerous videos designed to deliver crucial, up-to-date, and systemic medical and health knowledge in an easy-to-understand format. This is all towards ensuring better health and improved life quality for everyone. We greatly value your feedback and urge you to share your thoughts with us.